Dr. Mike LeNoir, and this is the Wellness Watch.
It's time for the Wellness Watch and Black Doctors Speak podcast with your host, Dr. Michael LeNoir, and co-host Dr. Noha Aboelata, Director of the Roots Community Clinic in Oakland, California. Today's segment, Keeping It Real with Black Health News of the Week.
Welcome to this week's edition of the Wellness Watch, Black Doctors Speak podcast edition. Again, this week, our co-host is Dr. Noha Aboelata. She is the director of a very fine health institution here in the Bay Area called Roots Community Clinic, a model for the area and a lot of work, I'm sure. Let's move away from COVID as if we could and talk about many other things that are happening around us at this time frame. Let's talk about mental health. The COVID pandemic pulled the Band-Aid off the sore that was poor mental health for everybody, and certainly for African Americans. You're running a very big health system responsible for all aspects of care. Obviously, you can't feed the multitudes. How are you handling the mental health issues in your major health system?
Yeah, it really is one of the biggest things that we face and have been facing really since we started Roots Community Health Center back in 2008. And I am a primary care physician, but most of my time, at least half, was really spent on various behavioral health challenges, whether it was depression, anxiety, or, they call it PTSD. We call it ongoing traumatic stress, because if you live in communities with high levels of community violence and disproportionate policing and racial profiling, it's really, you're living really in a constant state of, potential repeated trauma, and from a young age as well. And with the pandemic, all these things just escalated. And so we immediately saw increases in anxiety in particular. We saw people, who maybe were in sobriety relapsing, just all of the anxiety and stress of the pandemic that everyone experienced, but particularly people who already were challenged with behavioral health issues. So we really had to just continue to increase more mental health providers, making sure that all of our staff were really attuned to being able to just be there. We didn't close a single door during the pandemic, and that turned out to be very, very important, because a lot of people's sort of lifelines were shutting down and places were closing. And so we were able to be a place where people could still come and get not only their basic needs met, but also, their behavioral health needs. We had to build out a lot of telehealth, and so that people could, do counseling, over the video and over the phone. So we had to do a lot of adapting there and moved all of our groups to video engagements. And so just having to be creative as well to try to meet this really unprecedented need.
Yeah, that's it's been a big struggle for us just to get the kind of services that we need for parents and children on a day-to-day basis. Fortunately now, I think the community health clinics have provided us with an ongoing relationship with a child psychologist who comes to our office. But before that, we really had very little options for those kinds of things. Yeah, one of the things that you mentioned in your discussion on mental health was your use of telehealth to take care of mental health problems. We have been using telehealth since almost the pandemic began, and I have some impressions of my own. I just saw a study from Ochsner Clinic in New Orleans where they did some side-by-side comparisons with patients with hypertension, and we know how important that is for African Americans, using digital communication, telehealth primarily, Zoom and other forms. And they did the comparison with the traditional clinical approach to take care of hypertension. The group that was handled digitally did 3 times better in controlling their blood pressure, 14% higher in taking care of them and taking the medications, and 70% higher in patient satisfaction. What's been your experience with telehealth, and I think it's here to stay, but I don't know how, because once the third party people start paying for it, I'm not sure how far it's going to go.
Yeah, I mean, it needs to be here to stay. There is no question in my mind, and so I think it has really proven to be an important way to deliver care, not only for pandemic safety, which is still an important consideration, but just for all, overcoming many of the barriers that a lot of our population face. And so if you don't have to get childcare, you don't have to worry about transportation. These are major barriers that we all know about, to actually coming in person. And not all things require an actual physical exam. And so we know that.
Yeah.
Obviously, we want to be able to examine our patients when we need to. But the other piece is that here during the pandemic, where the safest thing indoors is to be wearing masks, it's not the best engagement, especially for behavioral health, to be having both people with masks on, trying to assess how someone is receiving what it is you're saying.
And a lot of that's theater anyway. The number of times where I walked into a room and heard a murmur on a kid, or saw something that and discovered it for the first time in a routine physical is relatively few. And when you don't have to haul in three other kids, get some babysitters for your other children, then I think it is a big change. And I can't remember a case, and I think we're lucky in that sense, where where telehealth engagement neglected to find something major, such that a child's life was threatened. And so I just think it's been just a real boon for those of us who practice in urban inner cities, because of just what you say, trying to get a child to the doctor, or for routine medical refill, or for just a kind of a viral infection. I think most parents need reassurance. And I think that this telehealth thing has been a real boon. Do you think we're going to be able to keep it as part of this?
I think so. I think it looks like it's going to require some kind of legislative action at the federal level to have it be a Medicare benefit after the public health emergency expires. And it does look like there's been an extension. So I'm hopeful that the purpose of that extension was to allow time for this legislation to go through. Because I think it's pretty hard to argue with the fact that this modality needs to be here to stay. I think the telephone visit will likely go away, but in terms of being able to be a reimbursable kind of a visit. But certainly, if we can take care of things by video and it makes sense. Now, with adults, we do worry sometimes about prolonged periods of time where they're neglecting to come in, and we know that we'll need studies and different types of preventative things for them. And with kids, we are also, of course, worried about them getting behind on their immunizations and things like that. Particularly now that, vaccines have all of a sudden become such a topic for everyone. We want to make sure that they're not forgetting about the routine childhood vaccines. But you're right. I mean, outside of that, and certainly for behavioral health, I mean, being able to sit and talk without a mask on for a good, 45 minutes to an hour with your provider and look at their face on a video, it's actually a lot more conducive. And so the biggest barrier that we've had to overcome, within a low income population is making sure they have the devices. So we've been doing a lot of work to get people laptops and tablets, and to train them. So actually they can come in and work with our staff, and they'll show them how to set it up and how to do a telehealth visit. But it has really been a game changer. And it's one of those things that I think has been kind of a plus, if I could say, of the pandemic. Because before this, we really didn't do telehealth. So I think it's a real kind of one of the positive things that actually came out of it.
Yeah, no, I think, the reason I'm back in the office is I missed the interaction myself. And so consequently, we see many more patients now directly in the office. But certainly, I think during that pandemic, it showed us how much is possible when you got people in their own setting, comfortable. Because a lot of times what will happen, if you took out what we call viral infections from your average daily census, it would cut it by a third. I mean, conditions for which people do not need antibiotics, but need reassurance. And so I think telehealth has certainly done a really big job for that. And I hope that it's here to stay. But here again, in what form, I'm just not certain. One of the other things that we don't talk about much, is what we call passion fatigue. Now, you just told us that you've been open and not closed for the whole period of time. That's been hard on my staff to kind of handle this pandemic. What about your staff?
Well, I think this whole thing has been very challenging, right? But I do think that particularly when things first happened and it was just scary. Nobody knew what was going on. We're scrambling to get enough PPE and all those things. I think it was anxiety producing for everybody. But I think, for the staff that, that come in every day that are really working on the front lines, I think that we've really been blessed that morale has stayed high. It can be tiring, and I think we all have to look out for each other and notice if there's any signs of burnout or anything like that. But I know that with a lot of our team, a lot of what's been reflected back is that somehow being part of the solution, really, doing COVID testing and providing the vaccines and providing the education has been a somewhat therapeutic in and of itself, rather than feeling like you're helpless on the sidelines. And so we've been fortunate in that, but definitely have kept all of the frontline workers in the ICUs and in the hospitals in our thoughts and prayers. Because they've really been holding down and I think experiencing a lot of the grief and loss really firsthand. And I do worry about our healthcare workers that are really going to probably be dealing with some of that trauma for some time to come.
Yeah, and I think we're talking about it for the healthcare workers that are listening to us. We recognize maybe before you do that these things weigh on you, and you have to take some precautions that you don't get, burned out and overwhelmed and depressed because of so much of what you've seen. I think we aren't seeing nearly the incidence of deaths, but every death, every life is precious to us, and we know most of these people. And those of you on the front lines, we're not. I'm on the second line, maybe even the third line at times. But those of you on the front lines, you have to be careful and take care of yourself because this kind of passion fatigue sneaks up on you. There's a good book on passion fatigue written by a doctor whose name I will list in the credit, who's written a book on passion fatigue, and I think that's something that we all need to be concerned about. One final topic that I think we ought to discuss because it's become such a problem is the opioid epidemic. I mean, I've lost 3 or 4 patients, teenagers, to opioids. I don't know what are we going to do about that particular phenomenon as doctors. I mean, obviously law enforcement is concerned about it, but how do we talk to our community about opioids? What can we say to parents about recognizing symptoms? What happens in your clinic?
Oh, well, that's a big topic. I have so many things to say about this. I mean, one thing I think that, is not lost on me is that when all of a sudden during the pandemic, people started talking about they don't trust the pharmaceutical industry and things like that.
Right.
It's like, look, I've been saying
Instead of
this
being
for a while.
instead of being a drug addict, you were the victim of the opioid epidemic
You
because so
know,
many non-blacks were now overdosing.
That's right. And we have to understand the complicit nature of of healthcare as an industry in general, and really the culpability of the pharmaceutical companies in creating this situation that we're in. And so I think being open about that is really important. And I think where we are now, I mean, what's really concerning to me, because you're hearing them overdose deaths, and I'm even pushing back to say many of these are actually poisoning deaths because there is fentanyl in a number that people are using, and they're not expecting to die. They're not trying to overdose. What they have is much stronger than what they think it is. And so the supply is tainted. And I think as we think about law enforcement cracking down, it needs to be at the source. When folks are battling with addiction, I think that's a separate issue. We've seen folks die who really were, for lack of a better term, they were partying, they were out one night, they did too much, they die. I mean, that is, And so not every overdose or poisoning death is someone who actually has addiction. And I do want to just name that. However, we do have a lot of addiction in our community. There's no question about that. And so it really goes to a number of the same things we're talking about with behavioral health. Are people's needs being met? Are their behavioral health conditions being treated and addressed? Are they housed? I mean, I don't know how many of us, how long anybody's going to stay sober living out here on these streets. And so I think we have to address many of the root causes. And we do also have to deal with the fact that what is coming into our communities is deadly.
Yeah, but I'm just as furious as you are. Well, I'm furious may not be the word, but I'm just as disappointed that it's now called a public health crisis when we've been dealing with it for years, and it was all about the drug addicts when it was purely in the African American, underserved, and minority communities. Now that it's broken out into the suburbs, it's a public health emergency with resources dedicated to it. And I'm still not sure that we're getting our share of those resources because I haven't seen much change in terms of programs for minority, for African Americans that are unique in terms of approaching this as a problem. And so hopefully some of those resources will get into the right hands. But I do think that parents have to be very vigilant in looking at what's happening with their children. I mean, changes in behavior and, times left out. So much violence in our community can be traced back to this drug issue. And so hopefully we'll find some kinds of solutions. I personally think one of the side effects of that, and you may see it in your practice, I don't see it as much in mine, is that people really need pain medication, can't get it. Because every doctor is so afraid of prescribing an opioid for an individual, and many people with chronic pain are going without being treated. So hopefully we can find the proper balance.
We'll need to find a balance. The pendulum is swinging a little too far the other way. I agree. And I think the other thing I'll just say is that in our community, drug use is criminalized much more. And so rather than getting that nice treatment and going off to some, nice rehabilitation facility, you're going to jail, right? And so it's a really vicious cycle. So I think we have to be in reality about how these things are also perceived and dealt with sort of on a society level as well, and do what we can to protect ourselves, our children, and each other.
Yeah, you always see these commercials for these Sunnybrook farms where people go for drug addiction, and they plant one black person right in the middle. And you go up to those places, you'll be hard pressed to find a lot of people who need those services who are black in these places. But
I just want to add one thing, Dr. LeNoir, if I could, is that I think that many of us are going to need to start to ensure that we have Narcan with us to reverse overdoses. And, unfortunately, my staff have had to reverse overdoses out in the field, out in the encampments, using naloxone or Narcan. And it may just be something that we all need in our toolkit and in our first aid kit, because we don't know whether it's prescription pills or whether it is heroin, or whether it was they couldn't get the prescription pills, so now they're going out on the street and getting something. If you have a loved one who is struggling with addiction or is on pain pills and may accidentally, take too many, having Narcan handy can save lives.
All right. Well, our time went by pretty quickly. I think we want to thank you for co-hosting it with us again. We look forward to you coming back in a couple of weeks. And at that time, we'll try to update and keep our audience updated on how we view the current situation in health, especially targeting African Americans. We always like to close our program by encouraging you to share our podcast with your friends. And we'll always remember that health is your biggest asset, so protect it. Okay, that was good conversations. We need to figure out exactly, in one major theme to discuss, and each time we get together. And you will be doing it every couple of weeks, and Donna can do it in alternate weeks. Okay. So that way, neither one of you is stressed. Both of you have the I mean, it's not like I don't have a busy schedule. Now, trying to run y'all down is part of my schedule. But people were so positive to your involvement and her involvement in these discussions because, most podcasts, I was getting a prostate cancer guy, a pulmonary guy, sleep guy, and talking to them for 30 to 45 minutes. When the attention span of this audience is probably about 5 or 10 minutes, and so changing topics
I like
is
that actually.
the key piece. And what we'll do is
COVID and mental health can stay topics every time if you want. I
yeah,
mean, we could think about what we want to highlight.
yeah, yeah. No, I think you just kind of pick up the New York Times and anything you see that's black and make a note of it, and then we'll have about a
Well,
10 minutes.
why was the subway shooter black? This is like the first time it's a mass shooter
First
is
time
black.
ever. I mean, here he is sitting around eating McDonald's French fries and turning himself in, yeah. And for focusing on the black chief of police, the black mayor of New York, blaming him for his anger and frustration. I mean, and it's so dumb the way. He didn't hide anything. There's no plot. I mean, he just for some reason just decided, hey, this is my day, and it was. But what amazes me, Denise likes to watch the FBI, that movie, the series on TV.
I haven't seen it.
And they trace everybody all over the place. They tell you but look how they trace this guy. They caught him coming into town. They caught him going through the turnstile. They caught him, walking the streets of the East Village. I mean, can you imagine how much surveillance there is on all of us? You see how they caught him driving in. They caught him renting the truck. I mean, video, they had a little documentary on this guy from the time he decided to do this. I mean, they caught it. Did you see him? The video of him driving into New York from Philadelphia?
No, I haven't seen it yet, but I read about. I mean, it's like, yeah, that's there's cameras everywhere. People who think they're doing stuff like anonymously are delusional. Yeah.
We should talk about some of those privacy issues as it relates to health. But I think this is good. And like I said, what we'll do is we're using I think our newscast starts tomorrow if they got everything done. But we use two of your PSAs in the newscast.
Oh,
and
great.
so make sure that you get proper credit for where your websites are and for the things that you want people to go to. But anyway, so this was good. So
thanks. Okay, next time I'll wear makeup. I thought we were audio again.
I'm not. I'm sure you can't say anything anymore to people like you're looking good. You go to the hospital, but you can't look bad.
Oh, I appreciate you.
Take care. Bye-bye.
All right, you too. Bye.